CYC is a free channel, presents the Word of God for everyone. Your support will help us to continue the mission. Visit our website, cycnow.com. Even $1 will make a difference.
Hello, and welcome back to another episode from our series on CYC MD. As you know, every time we are joined with a different healthcare professional and who gives us tips and insights, possibly even techniques, on how to achieve for a better and more healthier lifestyle. Previously, we were joined with Dr. Shady, who informed us on how to brush our teeth correctly, and we talked about cavities and many more questions that our viewers had sent us in regards to our teeth. Today, we are joined again with Dr. Shady. Welcome, Doctor.
Thank you for having me again.
Pleasure to have you again.
Thank you.
And we will be talking more on cavities, braces, root canals, cosmetic procedures, and many more topics that our viewers had sent us questions on. So without further delay, let's get to it.
Go for it.
So I know we ended our last episode we talked about cavities, we talked about toothaches, and we said a cavity was an opening in your teeth, and a cavity is something that just allowed for whether it be food or sugar or whatever to rest, and that in effect affected, can actually lead to a root canal, and we're going to talk about root canals. Right. We talked about proper procedures to brush our teeth, which we said would be in a circular motion. And so now let's just get to what exactly is a root canal, or let's talk about what a root canal is first.
I think to explain what a root canal is, I'll explain the procedure of a root canal.
Okay.
And that will give you an idea of basically, I think, what you're trying to understand. So again, we say we had a cavity, it went through the tooth all the way into the nerve, which is the innermost part of the tooth. It's the innermost part of the tooth because it's supposed to be protected, okay? A cavity, if it grows and grows and it's not treated early in the stage, it gets into the nerve of the tooth. Now, the nerve of the tooth is where the roots of the teeth are. Some teeth have one root, some teeth have two roots, some teeth have three roots. Usually, those are the choices. There's always differences, but those are normally the ones. The nerve goes through the root of the tooth.
Okay.
So, if a cavity has progressed into the nerve of the tooth, in order to give the patient comfort, we need to remove the root. Now, obviously, it's a very technique-sensitive procedure because we want to keep the tooth, but we need to remove the innermost part of the tooth. Mm-hmm. So we make an opening from the top of the tooth, and with very small files, we get in to clean the roots of the teeth.
Okay.
Again, and it's the innermost part of the tooth structure. So from the outside, the tooth still looks like a tooth, but we just went in and we're instrumenting the nerve of the tooth to remove the nerve, and ultimately what we're going to do is put a filling material where the nerve was.
Okay.
Now this will take away the discomfort because now the tooth has no more nerve, has no more feeling.
Almost like numbing the tooth.
Correct.
In like an
Absolutely. Absolutely. So that's really the procedure of a root canal. People, I'll tell you why people are always scared of a root canal. They're scared of a root canal because based on what we explained, your patient is in pain if they need a root canal. So they're associating the pain with the root canal. They don't really have anything to do with each other. Root canal gets you out of pain, but because they come in with that pain and maybe they do need a root canal, they've kind of already had a connection of root canal pain, which is not correct. The root canal removes the pain because it removes the nerve from the
nerve itself. And how many visits would it take in order, for this whole procedure to be done?
Very good question. It's really dependent on the roots. Remember I explained there was one root, two roots, three roots. The more roots, the more nerve there is to remove, and therefore the longer the procedure will take.
So basically, the more complex the problem is, the more you're going to have to return into your dentist again.
Correct.
Okay, wow. So, but if we had visited our doctor every 6 months, it probably wouldn't have gotten to be
Absolutely.
that complicated.
Absolutely. And the very important part of dentistry is education, education, education. Because that checkup, which will take a very short time and save you a lot of money and effort and pain and everything, is very easily preventable.
Right, and I think that goes also for many healthcare professionals
Absolutely.
and professions, that a lot of things can actually be prevented in an early stage should we keep up with our physicals when we go to the doctor, visit our dentist regularly.
Correct.
So I know a lot of adolescents we see need braces.
Correct.
I don't know I don't know exactly how you deal with problems like this, but how do you judge if somebody needs braces when they come to you? I know they have their own specialty, which is an orthodontist.
Correct.
And they're the ones that put on the braces and deal with that.
Correct.
But I think the dentist refers them to an orthodontist.
The dentist can do
Okay.
the orthodontist. The dentist can refer. It's just like anything else. The beauty of dentistry, there's multiple fields, but there's really no black and white. So some stuff you refer, some stuff you don't. There's no real distinction. And to get into why someone would need orthodontist, obviously our model over here, we have a very straight set of teeth, which is the most ideal. Patients may come in where the teeth are all crooked, some teeth in the front, some teeth in the back, and what normally is that happens is because the jaw doesn't have room maybe for all those teeth, so we'll help that happen. The other thing, this is called the class bite, when your front teeth are right in front of your top teeth and the molars are about how they are now. Some patients, you may see they may have what we call a class 2, when your top jaw is really in front of your lower jaw. Okay, and the other thing is a class 3, when your lower jaw is in front of your top, okay? So all these, right, other than the class 1, which is the ideal, need orthodontic treatment.
Right, I think they call it, I mean, I've heard it as an overbite,
Correct.
an underbite.
Correct.
Are these like the same
Absolutely.
terms?
So this would be the overbite,
Right.
and this would be the underbite.
Okay. And what if somebody has teeth that are just coming out from it's just not straight?
That's
That's also
reason, yeah.
another reason why they would need
Absolutely.
braces.
Absolutely.
And then I would say, I know a lot of things are individualized, especially when it comes to braces. So I think it depends on each situation, so that we could put a length as to how long they would wear them.
Absolutely.
And I know now they have Invisalign, and they have all these other cosmetic things that can hide the braces.
Correct. The length of how long you will need braces depends on how complex how intermingled your teeth are, or really what it is. And you want just a little bit of straightening? Are they really on top of each other? That's going to depend on the length of your
So it depends.
Invisalign is those clear type braces. Those braces are not for all type of procedures. Those are more for minor type of corrective orthodontics or braces. If your teeth are very complex, you're still going to need the traditional metal brackets, which are brackets that are placed on each teeth.
And a lot of people don't like that.
And the wires that are placed in that slowly help kind of move the teeth to that more ideal position.
Now, I know there's also a lot of cosmetic procedures that people go for to have that, that bright white smile that people see on magazines, on TV, that people like to have.
Correct.
So that when they smile, people see that their white teeth are bright and white.
Correct.
Are there different procedures, or how do people go about that?
There are many, many, many different types of cosmetic procedures, and like what you said, it's very patient-based. What might look funny for me, you may say, "Oh, I'm perfectly fine with this. It's normal." So that's something that doesn't need to be addressed. But some people are very conscious about their teeth, and obviously, once you start talking to somebody, it's one of the first things that you notice on somebody. It helps boost people's self-esteem, amongst many other stuff. So yes, there are a lot of cosmetic procedures, and what cosmetic procedures basically do is, based on what the patient currently has, we try to make the smile bigger. Some patients may have maybe small teeth, and it looks funny, so a cosmetic procedure would be to increase the size of the teeth. Okay. Crowns. If a lot of people may have teeth that one tooth is very small, one tooth is very big. So really there's a lot to be done, and there is a lot of options involved.
Yeah, and of course everything you would just sit with your dentist and discuss. Absolutely. Again, individualized.
Absolutely. And that will happen at your exams every 6 months. If there's any concerns, you voice it to the doctor, and they'll let you know, oh, we could do this, this, or this, or we could do this, this, or this, and they'll go through everything specifically.
Now I know you did give us some things to keep in mind, brushing your teeth twice a day and techniques on how to brush your teeth. But are there anything else that you can probably recommend or give us tips on how to keep your teeth as healthy as possible for the longest time? Because I guess as you age, so does everything else. You Correct. Age, your teeth get weaker, Correct. Your enamel wears away. Correct. So what can we do, whether it's regards to food, whether it's regards to cleaning, to keep Correct. Our teeth strongest for the longest time?
Good. Well, we went through the checkups every 6 months. That's really well, I'm gonna say that, and you doing your good job brushing and flossing, those are the really two key elements. Anything else that happens is part of life necessarily. So yes, some people may grind their teeth at night. We have something for that. The patient would sleep with a splint to minimize that tooth on tooth contact, and therefore lengthen the time the patient would have their teeth. The toothpaste that have the different materials in it, the fluoride, the tartar control, anything like that. So really it comes down to the checkups with your dentist, you doing a good job, and diet plays a very important role. A patient who eats lots of, for example, hard nuts, with time may eventually crack a tooth. The tooth only has so much work that it could be done. As compared to someone who's eating kind of more softer foods, is cutting their foods a little bit better before relying completely on their teeth. So that's just a way of keeping your teeth as long as possible.
So like even as far as like maybe like fruits are concerned, for like an apple, Correct. Do you think it makes a difference whether somebody cuts like their apple or bites into it in regards to like it being like hard foods or?
Correct. I mean, our teeth are very strong. Teeth are the strongest bone in the body. So,
Is it? Really?
Yeah,
Wow.
It is. We don't need to go crazy, but at the same time,
maybe something to be cautious of as
Correct.
you get older.
Absolutely, something to be cautious. I agree with that statement. As compared to nuts, if I'm eating nuts and I'm biting onto nuts every day on my front teeth, yes, that's going to have a more harmful effect than having an apple. And apples, it's not, an apple you should have no problem being able to bite into it.
Okay. And I know this might not be fair to me to like ask you this question, but a lot of people always care, and a lot of people always ask, as far as recommendations, oh, is this dentist a good dentist? What are your experiences with this dentist? They always want to make sure that before they start visiting this dentist, that this dentist has a good history, takes care of whatever. So if they get referred to, if somebody refers them to them, then they like that because it's like, okay, my friend had a good experience with them, let me try to visit them. How would you judge? I don't want to put you on. I don't want to put you on the spot. But how would you judge if the dentist I'm going to is a good dentist?
Perfect. That's a very good question, and it really boils down to the time the dentist spends with you and how they explain everything. You could go into a dentist, you sit down, you take x-rays, they do a cleaning, and say, okay, bye, you're good to go, bye-bye. That might not be as positive as an experience as someone who sits down and explains the necessity of cleaning the teeth and then maybe shows you the x-rays and says, oh, look, you have this small cavity over here, and it's good that we're catching it early so that we could save it before it becomes anything bigger. Maybe it really comes down to the interaction that you're having with the dentist and how comfortable you are with them. And that's really my number one. Anytime someone would ask me something like that, I'm saying, see how that person is regularly, and that's going to reflect on how they are as a dentist.
Thank you so much,
You're welcome.
Dr. Shahidi, and I'm sure you're a great dentist.
Thank you. Yes,
And
I'm very
you,
nice.
you gave us so much information, and it was really a pleasure to have you.
Awesome. Thank you for having me again.
Thank you so much.
Thank you.
We hope you enjoyed our episode today on CYC MD. We hope we answered many of your questions regarding how to brush your teeth, how to take care of your teeth, and you want to keep your teeth as healthy as possible for as long as you live, and you want to always be smiling to show off your teeth. We hope you enjoyed our episode, and if you have any questions, please feel free to email us at the link you see below. Until next time, God bless.